everyone, good morning once again, and welcome back to my YouTube channel. It's nice to have your audience here. Yeah, so straight to the point, today we are going to be talking about your toothbrush. What is the right, and not just the right, but the best toothbrush for me to use? Because you could actually be using the best toothbrush. Yes, this is the toothbrush that is specified for you. But at that point of time or at that moment, is it the right toothbrush for you to use? So we'll start with a brief description of what a good toothbrush should look like. So over here, I have a toothbrush. You can see this toothbrush. A good toothbrush should have a small head. You can see the small head of this my toothbrush. A small head, a thin neck. You can see the neck. A thumb rest. This is your thumb rest. The thumb rest is important because it's needed for support and balance. And then a reasonable handle. You don't need ones that their hands are so long. You can see that this handle is quite very reasonable. So a reasonable handle to help you with control and also navigation when you are brushing your teeth. So that's it. And then we'll move over to the classification of your toothbrush, because whatever toothbrush you're using, there are factors you need to consider when you're using them. So first of all, we start with the nature of the bristles. In the olden days, our forefathers, they don't have this synthetic toothbrush that we have. No, they don't. So they use bamboo. There's even this particular one they call miswak now from Saudi Arabia. Some people still use it. Yes, some people still use it. Don't worry, someday we'll talk about your chewing stick, what is involved and the rest. But for today, we're focusing on the toothbrush. So this natural toothbrush, they have their own advantages and their own disadvantages. The advantages is that they are eco-friendly, they are environmentally friendly, in that when you are done using it and you throw it away, they will easily decompose. So they do not pose any harm to the society, to the animals, to human beings, no. Then we have our synthetic toothbrushes. These ones that are manufactured, like example is this one that I'm holding. So this one also has disadvantage and disadvantage. Okay, sorry, back to the disadvantage of this natural toothbrush. The disadvantage is that most of them are usually coarse. They are usually more abrasive, and we talked about wearing away of your enamel. So long as it's coarse and abrasive, you are definitely going to wear away your enamel, making you exposed to shock. Okay, so we'll come back to this synthetic toothbrush. This synthetic toothbrush is the one that a lot of people use. In fact, this is our century now. A lot of people use this synthetic toothbrush. It also has its advantage and disadvantage. The advantage is that you can easily manipulate it to the right technique you need to use it for. Yeah. And then it's not so abrasive that it can actually wear away your teeth, except if you are using the hard one. Then its disadvantage is that it is not biodegradable. It cannot easily decompose. That's why when you throw away your toothbrush, you see, even for a very long while, that toothbrush is still looking the way it's looking, though it's not decomposing. Okay, so we'll go to our next classification. Our next classification is based on also the nature of the bristles too. So we'll talk about the degree of hardness, degree of softness, or how medium it is. So we'll talk about the soft brush. Yeah, I know we have children at home. We have our babies. Some people will be like, what age can I start brushing my baby's teeth? My dear, once you start seeing teeth there. Anyway, there's going to be another video for how you take care of your infant teeth. But at the age of 2, in fact 2 years old, your child's baby's teeth is complete. So by 2 years old, of course, you've already started using the baby's toothbrush. So baby's toothbrush are usually what? They are soft. Your child does not need a hard brush or even a medium brush. In fact, from the age of, let's say, once your teeth start coming out, 6 months, your baby's teeth is already coming out, 7 months ahead. So till 9 years, 10 years, your child should use a soft toothbrush. It's very important because of the amount of pressure in it is usually lesser. Then the next toothbrush is our medium toothbrush. Example is this one that I'm holding now. This is a medium toothbrush. Who needs a medium toothbrush? A medium toothbrush is required by adults. Yes, our mommy, our daddy, your uncle, your aunties. Yes, an adult needs a medium toothbrush. You don't need a hard Bristol toothbrush as an adult. You need a medium Bristol toothbrush. Why? With it, you can apply adequate pressure and remove the deposits on your teeth. Then we'll talk about the hard brush. My dear, it is not much of how hard your brush is. No. It is much of what is the texture. Are you using the right texture? Are you using the right technique? So, as both an adult and as a child, you don't need a hard brush. Then, who needs a hard brush? Who needs a hard brush? A hard brush is needed by those that wear artificial teeth. Yes. And it's not like you are applying it directly on that teeth. No. For example, you see people that wear dentures. Dentures are artificial teeth that you can easily remove. They will ask you, okay, before you go to bed at night, remove it and put it inside water. When you wake up in the morning, as you are washing your teeth, you are also washing the denture. So you can use a hard brush and wash your denture. Then also, you can also use a hard brush for your retainers. Remember, our video our video is done in such a way that we want you to understand concepts in the grassroots level. Despite your ethnicity, your cultural background, your educational background, we want you to understand what we are talking about. And these facts are both from practical as what we see in the clinic when we are treating patients, and also system as in scientifically proven facts. You see what we read in our books. Yes, we read, but also what we also see helps us to understand much better. So, like we are saying, it's also used for retainers. What are retainers? Retainers are they can be made of ceramic or other materials. They are used on your teeth after you have done your teeth arrangement. You see some people wearing things like iron on their teeth, or it can even be ceramic braces. Yes, once they are done with the braces, which is to correct the arrangement of their teeth, a retainer is put there so that your teeth will not go back to the way it was disarranged before. So it will maintain the position now the right position now that braces has given to it. So you can use a hard brush to wash your retainers too. Okay, we'll go to another classification of the toothbrush. So we'll talk about the design. In the design, we have two concepts there. Number one, we have the manual, and then we have the what? The electronic toothbrush. You've seen people say, hey, I have an electronic toothbrush. Yes, it's fine. It's okay to have an electronic toothbrush. But then, electronic toothbrush are good. Why? For people that don't like brushing, I don't like brushing my teeth. Electronic toothbrush is advised for you. I don't have all the time to brush, to come and start brushing. An electronic toothbrush is also ideal for you in that aspect. Now, it is good to use an electronic toothbrush, but it also has its own advantages and disadvantages. So what are the advantages? Yeah, if you have a built-in timer, it's quite faster. You don't need to go and, it looks like, let me say, like in terms of sophistication, it looks sophisticated, big man things, that kind of thing. Yeah. Then what are the disadvantages? The disadvantages are there. Number one, electronic toothbrush needs maintenance. You need to charge it, or you need to be replacing the batteries. Then secondly, if it falls on the floor and breaks, my dear, you might need to get another one. Yeah, you might need to get another one. Then also, usually it has been found out that people that use electronic toothbrush do as in come down with certain oral health condition. Yes, certain oral health condition, especially in terms of wearing away their enamel. Why? Because they don't buy the ones that have timer. So if you must use an electronic toothbrush, go for the one that has built-in timers as well as pressure sensors, because you might be saying, okay, is it not just rotating? Both the sonic and the rest. Is it not just rotating? No. You need to know the amount of pressure you're applying there. So most people, they don't care about the amount of pressure. And then they don't also buy the ones that have inbuilt pressure sensors. So that's it. So if you are going to use an electronic toothbrush, if you must use it, use ones that have built-in pressure sensors to monitor the amount of pressure you apply on your teeth while using it. as well as timers. It will tell you this is the right time to brush, and once it's time, it will indicate it is enough. So with that, you'll be able to brush better. Now, go back to our manual toothbrush. This is the one we use every day. In fact, most of us we use our manual toothbrush, and that is good. Our manual toothbrush also has its advantage. Number one, is ready available. Of course, it's cheaper compared to your electronic toothbrush. Then also it comes in various brush tools which you can easily indicate this is hard, this is soft, this is medium. Now, we have talked about this toothpaste, like what is an ideal toothbrush, what should an ideal toothbrush look like. We've talked about the classification, and in whatever we've talked about the advantages and the disadvantages. Now, I go back to the question I asked. Is it just knowing the best toothbrush I should use? As an adult, yeah, I should use a medium bristle toothbrush. But what if at that particular moment in time, this is not the best toothbrush for me? I'm going to give a scenario. When you brush, you see blood. This is something that a lot of people have experienced. It's something that you see it, then you maybe probably in one way or the other you've experienced it. So when you brush, you're seeing blood, your gums are bleeding. We have gum disease, you have gingivitis, your gums are inflamed, they are reddish in color, they are paining you. In fact, when you after brushing, your gums are swollen and the rest. My dear, at that moment, yes, as an adult, you are using your medium bristle brush, but hold on, there's something that is not right there about that particular toothbrush you are using at that moment. Usually, when your gums are bleeding, it's important you visit a dental clinic, because when you visit a dental clinic, a diagnosis has to do with what is actually the cause of this bleeding gum. Why is my teeth why are my gums bringing out blood? Most times it's because of plaques. Plaques are soft deposits that are on your teeth. In fact, that is the primary cause of your bleeding gums. So when you go to a dental clinic and then an examination is done, then the dental therapist is there. You say, okay, we have to do a teeth cleaning. Teeth cleaning, I don't mean with your brush. They use machine, and then they remove that plaque. Now, when that plaque now, is soft, it's a soft deposit. When it now solidifies, it now becomes a hard deposit. That is the calculus. So when they remove the plaque and the calculus, and then, yes, we've removed the primary cause, but then there are some things you have to do afterwards. And that falls back to your brushing, because definitely that the cleaning is done doesn't mean that you will not still brush. You are still going to brush. So now, the scaling and polishing or the teeth cleaning has been done. But for the next 2 weeks, as an adult, you cannot be using a medium bristle brush. No. The dental therapist will recommend a soft brush for you. You remember, we say soft brush is for children, right? Ideally for children. But at that moment, you are an adult, but because you have a bleeding gums and some instructions need to be given to you to help you heal up, the dental hygienist or the dental practitioner there will recommend a soft brush for you. For the next 2 weeks, you'll be needing a soft brush with some other post instructions that will be given to you, like your rinse with salt and warm water, your vitamin C, and the rest. So you see, at that moment in time, you need a what? A soft brush. So it's important you understand this concept. It will really help us, and also it will really help you maintain a good oral health care. Now, I also want to talk about something else. Why is their bristle? This is what we'll talk about bristle. These are your bristle. Should my bristle be equal or should it not be equal? We don't want to know about brand. No, professionally, brand doesn't count. Professionally, what counts is what is the ideal thing. Okay, so I'm going to give an example. You can see this bristle here. Let me position it well so you can see. You can see that here is a little bit higher than the center and then coming down. You see the way it's curved. Now, we recommend a toothbrush that the bristles are equal. Yes, your toothbrush, the bristles should be equal in length. you ask, why should it be equal in length? Remember, whatever we are saying here, we are talking about it from both clinical, like clinical experience, what I've seen when I'm treating people and the rest. Once these bristles are not equal in length, some part of your teeth will be missing. When you are cleaning, you won't clean well. In fact, you see a part is clean, a part is not clean, especially in between the teeth. It's in between the teeth that even suffers more. So you'll be like, in between my teeth is dirty. It's as if there's a zigzag movement kind of cleanliness in my teeth. Some part is clean, some part is dirty. That is because your bristles are not equal in length. Also, it might not adapt to the normal contours of the teeth. This is how my teeth is being, now, this is it. Let me give an example. You see what I'm saying? You see what I'm saying? Your teeth has the way. See the way it's shaped. So this brush might not adapt to the normal contours of your teeth. And that is not a good one. Good. Okay. Back to our hard brush. Why should I not use a hard brush? Why should I not use a hard brush? It's important you don't use a hard brush. It's not a matter of how hard the brush is. No. It's a matter of what is the right brush you're using. What is the right technique you're using. For example, this is a hard brush. I'm going to give examples. You can see this brush. Looking at itself, you know that the brush is quite hard. A hard brush is no good. Why? We'll go back to a replica, a model that represents a replica of our teeth. Do you know what hard brush does? Over time, you are brushing this way. Not just that you are brushing this way, you are using a hard brush. What it does is that it wears away your enamel. And remember, we talked about the enamel being the outer protective layer of your teeth, being the soldier of your teeth. And once anything wears away your enamel, you are now prone to what? To sensitivity or shock or other oral health conditions like even tooth decay. Yes, even tooth decay. Because your outer protective layer is being worn off. So over time, these things might not show, but over time, you will begin to see that your enamel is being worn off, and then you start feeling sensitive. Another thing is that you see this your gum here, you see the normal level. This your gum now has a normal level it should be. There's a normal level of attachment it should be. But because you've been using a hard brush over time, you'll be pushing down your gums. You'll be pushing down your gums. As you are pushing down your gums, you are exposing your root. And once your root is exposed, a lot of things can enter there. You can even people have holes, cavities on their root. People have infections on their roots because it is exposed. And that's what a hard brush can give to you. Another thing a hard brush can do is that a hard brush can also cause gum bleeding on its own. Yes, because the gum is hard and you're applying a lot of pressure already. Your gums will swell up. This is what we call inflammation. If you talk about inflammation has to do with a tissue response to an injury. Your gum is a tissue. And then with your hard brush, you are scrubbing. Now you've injured your tissue. It's going to respond. And when it's responding, you see it will swell up. These are signs of inflammation. Your gums will be swollen. It will start bleeding. It will be very reddish in color. You might even develop high temperature. That's why you see some people, after brushing, you'll be like, my mouth is paining me. I just finished brushing, but anytime I finish brushing, my mouth is paining me. My dear, do not use a hard brush. In all your dealings, do not use a hard brush. If not, you will come down with a lot of oral health conditions, which is not good. So I know you really learned a lot of things from this video. Thank you for viewing us. Our next video will be based on, okay, let's give this scenario. I have a bicycle and I have a rider, or I am a rider. I can ride a bicycle. Now, the bicycle is the toothpaste that we talked about. Remember what we said, you should always use a toothpaste that has fluoride. It is very important. We don't care the name, the brand, no. Let it always have fluoride. That's the most important thing. Then, secondly, now we've talked about the ideal and the best brush for you to use. As a child, you need a soft brush. As an adult from 10 years up, you need a medium bristle brush. Yes. And then even for your appliances like your denture and your retainers, you should use a hard brush, but you should never use a hard brush. Now, what if I have a bicycle and I'm a rider, but I'm not riding my bicycle very well? What will happen? I can injure myself while riding my bicycle. I can injure people around me. I can even spoil the bicycle. That's exactly what it is here. So the bicycle is your toothpaste, the rider is your toothbrush. Now, how you ride the bicycle, the pattern, the technique of how you ride your bicycle is now the pattern of toothbrushing. So stay around. In our next video, we are going to talk about the ideal technique to brush your teeth. The pattern, what pattern should I use to brush my teeth so that I can brush very well? Because some people like, I brush very well, I brush very well. Yes, in your own little way, you are doing very well in your own little way. But there's another that say that what you don't know is more than you. But also you can decide to learn anything. Anything can be learned. Anybody can learn anything. With consistency, with dedication, you can learn anything. So follow up, subscribe to our YouTube channel, and I'll see you in my next video where we'll be teaching about the right technique, the right pattern to brush your teeth. Thank you. See you next time.